And welcome back, everybody. Well, many of us still have questions about the coronavirus, how it spreads, and how to keep ourselves safe during the outbreak. So we wanted an expert to answer all of those health questions. Nurse Alice Benjamin joins us live over Skype this afternoon. Nurse Alice, thanks for being with us.
Thanks for having me, Michael.
You ready to dive in here?
Absolutely. Let's get to it.
All right. The first question is one we've been getting a lot here. Stacy Rivera wants to know, how do you tell the difference between coronavirus and seasonal allergies?
So this is a great question, especially since here in California, we are actually in our peak season for allergies. So allergy season generally starts at the end of January, peaks in April, and goes all the way till May. And what an allergy is, it's a hypersensitive response. Our immune system is reacting to a foreign substance that it believes is harmful, like pollen from trees and plants and dust. And so we're generally exposed to that allergen, and then we have an immediate response. And we also know that if you have allergies, it's not contagious. Whereas coronavirus, something different. So the coronavirus is when you're exposed to the actual SARS-CoV-2 virus, and that is contagious. And what we know is that once you've been exposed, there's a delay in symptoms. So anywhere from 2 to 14 days after exposure is when you'll start to present with symptoms. And now the symptoms between coronavirus and allergies are very different. And the easiest way I can say it is, if you're someone who's experiencing allergies, it generally affects you from the neck on up. Watery eyes, itchy eyes, runny nose, your ears feel clogged, scratchy throat. Those are allergies. When it comes to the coronavirus, although there are several symptoms that you can feel, what we're most worried about is fever, cough, tiredness, and shortness of breath. So when you start to have symptoms that are beyond kind of that head cold type of symptoms, you may want to think exposure to coronavirus. And another thing that separates the two is, if you have allergies, if you change your environment, remove what you think you might be allergic to, and take some over-the-counter allergy medications, symptoms go away, not a problem. When it comes to the coronavirus, even if you change your change your environment, you still will have symptoms. We ask you to kind of self-manage at home with, fluids, rest, take Tylenol if need be. But with the coronavirus, we also know that sometimes that self-management gets out of hand and it might require hospitalization. And we know that there's no cure because it's a virus and it needs to run its course. So those symptoms will last longer, anywhere from 2 to 3 weeks at least generally. So hopefully that helps people distinguish allergies versus coronavirus infection.
All right, process of elimination when it comes to allergies. All right, so Who's most at risk for getting coronavirus?
Wow, so people who are essential workers, people who are going to have prolonged or frequent contact with people, and that's just because we know that this virus is a respiratory virus. It's spread through droplets. So when someone coughs, sneezes, laughs, those droplets can travel anywhere from 6 feet. So if you're going to be in contact with someone or with frequent people and have that type of exposure, you are at highest risk for getting it. Now, we also know that if you have a pre-existing condition, you're elderly, very young, you are at risk for more severe complications. So long story short is everyone's at risk. You want to minimize your exposure, stay home, wash your hands, wear your mask, and then just really try to stop the spread by doing those things.
All right, I'm going to jump the question here, but I want to ask you this one. The next question comes from Susan Mix. Susan wants to know, if you had coronavirus, how do you know when you're no longer contagious?
Great question. And so one of the key features of that will be most people with coronavirus will develop a fever. You need to be fever-free for at least 72 hours, and that's without taking any Tylenol or Motrin or anything to control your fever. So fever-free for at least 72 hours, and then also have improving or your respiratory symptoms are eliminated anywhere from 7 to 10 days from first symptoms.
All right, a lot of great information here. We, of course, want to thank you, Nurse Alice, for being with us. And you can keep up to date with Nurse Alice on Twitter, Facebook, and Instagram at Nurse Alice. Pretty easy to remember. And do you have health questions? We want to know. Post them on our Facebook, Twitter, and Instagram using the hashtag AskNurseAlice. She'll be answering your questions live on the air every Thursday on the NBC4 News at 4.
Thank you, Nurse Alice. Do you have weather questions now? Let's head outside.